Okay.
Hey everybody.
Today
Yeah, go ahead, Tammy.
today we are here to do a webinar, and the purpose of this webinar is to discuss what the clinical instructor's responsibility are to communicate the learning objectives for a physical therapy assistant student on their clinical. My name is Tammy Marson, and I'm the Academical Clinical Coordinator for Ori Georgetown Technical College, and I'll let Sean introduce himself.
Yeah, I'm Sean Glassberg. I'm Director of Faculty Development here at Ori Georgetown Technical College. I'm the one in the striped shirt, just to clarify. Tammy's the one in the, would you call that a turtleneck or some sort of high neck sweater? Okay.
Definitely.
So we all know who we are.
Good.
Go ahead, Tammy.
Sure. What I'd like to do is run through the objectives of this webinar. The first one that we would like for the learner, that they will be able to define what an actual learning objective is.
Yes, and in this case the learner is the clinical instructor. Since only clinical instructors are going to be watching this webinar, this is what they'll be expected to be able to do upon the end of this presentation.
Right. The next one is we would like the instructor to be able to explain why a CI should communicate learning objectives for the course with a PTA student. The third is we want them to be able to identify the steps that the CI should take to instruct learning objectives to a PTA student. The fourth is we want the CI to be able to explain how they would develop short-term objectives that relate to the overall learning objectives for the course. The next one is we would like the CI to be able to communicate with the student regarding performance toward their learning objectives. So we hope at the end of this presentation today that we will be able to meet those objectives of this webinar.
Awesome. Well, I guess the next thing that we want to do here is to just define a learning objective, or at least highlight what that is. And Tammy created this slide here, and you found a pretty good definition that is stated as such.
Yep. A learning objective is a statement that provides the student and the instructor a clear picture of the outcome of the performance as expected. And it's very important that we understand learning objectives because it gets us all on the same page.
Okay. I know we're going to get into where we could find the learning objectives in a little bit, but I think that you wanted to explain why it's important that a clinical instructor in the PTA program communicates learning objectives to the students.
Yeah, let's go to the next slide, Sean, and I will let me go through that. Why it's very important that a clinical instructor communicates learning objectives to a PTA student is mostly because there needs to be a mutual understanding, an agreement of what the objectives are. The second is that it definitely empowers the student to take initiative to be proactive. If everybody's on the same page and everybody understands that they're interpreting the objectives the same, then we'll all be heading in the right direction.
Okay. Now, I know that we've got a few documents that we're going to share with the clinical instructors that are watching this webinar. We're going to get to those in just a minute. So what determines the clinical learning objectives for a student?
The academic institution will actually determine the objectives for the clinical for the student. So there are academic program objectives that we will provide to the clinical site, so they will know what our expectations is of what that student needs to achieve. The other thing that sometimes can affect the objectives for a PTA student are actually what the facility resources are, what they actually have available.
Okay. Now, if I'm a CI and you're going to share these objectives with me, you know, where are they?
That's a great question, Sean. The academic learning objectives can be found in the syllabus. Okay? We'll find that information in the syllabus, but we can also find that information on the clinical assessment tool.
Okay.
The assessment tool is what we use to measure the success for the student toward those actually objectives.
Well, let's look at the instructional package or syllabus first, and then maybe you can show me where they are.
Yep. So what you're seeing here is our second clinical instructional package, which instructional package is just another word that we use for syllabus, and this is PTH 253, and for Georgetown Technical College, this is the second one that do over the summer. But for any of our clinical rotations, their syllabus are all going to be very familiar. So Sean, if you scroll on down, I believe it is on the second or third page.
Okay.
The initial part of the syllabus is going to tell you what the student has to complete and things that they have to do prior to that. You just
there we go.
There you go. The student learning outcomes are the academic program objectives. I apologize for the difference in the names, but the student learning outcomes are where we expect them to be at the end. So let's just look at the first one. The first one states that the student will be able to review the plan of care established by the physical therapist prior to initiating patient or client interventions with guidance from the clinical instructor. And so an example of that is that the student needs advice from the clinical instructor to expand knowledge or skills. So now Sean would flip over and pull up the clinical assessment tool. We can show you how we then measure this. If we go down, I believe it is on the second page of the assessment tool, Sean. You'll see the number 1 under the performance criteria. You'll see plan of care, and you'll see the number 1 is that we want to be able to review. We want the student reviews the plan of care established by the physical therapist prior to patient and client interventions. Now we require a 4 on that, and that was kind of discussed in the other webinar that we have available online as far as how to grade this tool. But that would tell you, if you go down to the very bottom of this second page, Sean, that will tell you, it will define a 4 for us. Right there. Performs only with confirmation from the clinical instructor. So if you look at the objective for the course, we tell you where we would like the student to be, and then the assessment tool, they're linking those 2 items together so it shows us how to grade that.
Okay. Awesome. So those are the 2 places really where the academic program objectives or the learning outcomes, whatever word you want to use is fine. That's where they are.
That's where they are. That's
and
exactly
so
right.
Clinical instructors, if I'm playing the role of a clinical instructor, I will know before I meet my students exactly what I should be expecting of them.
Yes, we mail out a hard copy of the syllabus in the instructional package 30 days prior to the student coming for the clinical instructor. So they have that information available to them. But that information can always be found online in our clinical manual, which is on the George Technical College website also. But we do mail out the hard copies for the clinical instructor prior to the student coming.
Okay. Okay. I'll go back to this right here. Now, I know these objectives, right? As you said, there's places where I can go as a clinical instructor to find the objectives. I imagine I can also get some help from either you or Larry Koppelman about what I'm supposed to be looking for. So I have the objectives now. What am I supposed to do, before students get there?
This is a great opportunity for the clinical instructor. The first thing that I would recommend that any instructor do is that they review the learning objectives or the outcome, and then they review the clinical assessment tool utilized by the CI to assess the students. Those are the 2 tools we first looked at that the clinical instructor will get 30 days before. After reviewing those tools, the CI should note which of those objectives that can be achieved at their facility. We do know that facility resources vary. Some facilities have the ability to do wound care. Some facilities don't have the ability to do wound care. Some facilities may be treating only a certain patient population, which may limit some of the objectives that are available for the student to achieve. And so the CI should probably sit down and highlight the ones in the syllabus that states automatically which one these students will be very likely to achieve, so that when the student comes, they're kind of heading in that direction of what can I do here versus then what can I not do here. And that also helps us as far as an academic institution, because if we're limited on those opportunities, it helps us to be able to set their next clinical up so that they are getting maybe exposure to modalities that they did not necessarily get exposure to at one particular clinical site.
Okay. Do you want to look at the assessment tool and maybe point to an example of where? Okay, let me go ahead and pull that up. So, for instance, you're saying like perhaps wound care may not be available.
Actually, just go back up just one, Sean, there where you just were. You see number 3 right down to the bottom of the page. Number 3 right there on the bottom, it says perform isokinetic strengthening and therapeutic exercises directed by the plan of care or as directed by the plan of care in the clinical setting. Well, some facilities may not have a machine that will do isokinetic testing. It's a
Okay.
specialized machine. And so easily that goal should be pointed out to the student that this is not something you're going to be able to achieve on our clinical site because we don't have that particular tool available for you to achieve. It's not that they should just ignore and not understand what isokinetic is, but they just need to have the understanding they wouldn't be able to achieve it.
So as a CI here, if I'm using this tool to assess, do I write something in here like not available at this site?
Over in the little boxes on the left, they would
Right.
put NA.
Oh, okay.
Yeah, they would put NA there that would be not available to us.
Okay.
And yeah, that definitely. Yep.
Cool. That's very helpful for sure. I'm sure that sometimes, and CIs, especially new CIs, might not know what to do there, and then this is a good way for them to understand what to do.
Yep.
Okay.
Definitely. Definitely. Okay. The CI then will consider what types of teaching opportunities are available to structure an effective learning environment. So everybody is understanding between the CI and the student. They're mutually agreed upon what the student should be able to achieve at that clinical site. The next one is then the CI may develop goals that are specific to the facility that meet the learning objectives established by the academics institution. Sean, can you click back to that assessment tool real quick for me
No
for a
doubt.
second? And let me give you a little bit of a specific example. We can just leave it right there, Sean, for a second. And let's say it says identify anatomical location and function of the treatment area. That's a pretty broad goal. And as an academic institution, we write those goals a little bit broad because there are quite a bit of variety in clinical settings. But this is where a CI may tweak that individually to their clinical setting. At some facilities, CIs may be highly specialized in one area, and their clinical instructor may be very specialized in treating the shoulder. And that may be their area of expertise. And as a clinical instructor, they could easily expand that goal just a little bit and say, by the end of the first week, because I see such a large patient population that deal with shoulder injuries, is I need you to be able to identify the anatomical location of the shoulder and all the musculoskeletal or the bony prominences that deal specifically with that shoulder. So that's how they may fine tweak it to their specific facility.
So how they develop objectives then in this case if they've never done this before and now they might be able to take advantage of an opportunity? What do they have to consider?
They have to consider first, let's go to the next slide, Sean. Let's come back to that because that's a great question, and I think we kind of talk about that a little bit on the next slide there.
Okay.
What the CI should take to communicate objectives upon the student's arrival, and this is going to hopefully answer your question, Sean, is first the CI informs the student of the academic learning objectives, their potential mechanism, and how these objectives are to be achieved at the facility. So we kind of already covered that. Let's look at the next one, as I think this will answer that question. Is the CI assesses the student's knowledge, and that's very important because if the CI is working with a student, and depending on what clinical affiliation it is, the CI first wants to make sure that the student has academic understanding of the shoulder and the musculoskeletal. And if they are working with a student who was in a different types of clinical environment, like let's say they had been in acute care or in a rehab setting or home health and had not been in an outpatient orthopedic setting, they initially would have to make a goal that I need you to go back and review your anatomy of the shoulder. Or they may work with a student that this is their second orthopedic rotation, and they may have strong anatomy of the shoulder. And so then their goal is going to look significantly different.
Okay.
So what they need to do first is assess where the student's knowledge is. And that is very helpful, whether they have basic exposure, whether they have some level of knowledge, or whether they're mastery, whether they're just pulling this right off because their last CI treated a very patient-similar mix.
Okay. That makes sense.
The CI and the student develop short-term goals, objectives to meet the course outcomes and learning opportunities to meet the short-term objectives. Let's say, for instance, on this one, if we flip back over to that assessment tool real quick, Sean, I'll give you an example of this one. If we go down, maybe go down one more. Okay, we'll go ahead and let's stop there. We'll see like number 8, performance balance training. Okay, that is a very simple goal that we want the student to be able to perform balance training. So once the CI understands that the student's level of knowledge is what are balance, why do we have balance issues, multiple different reasons, but why do we have balance issues, and then the CI may ask the student, okay, first this week is I want you to identify what this patient's balance issue is, and then the goal for the next week would be, okay, now I want you to be able to perform these exercises for balance, and then the third week maybe I want you to be able to progress the student's balance exercise program. So the CI can then start to make short-term objective to meet the overall objective of the course. Does that make sense?
Yeah,
Yeah.
I'll tell you what, these CIs have a lot of responsibility. It seems
They
like,
do.
and it seems like it's pretty important that the students understand that it's not like they're just going to get in there and do. They're gonna go through some rigorous assessment before they even start.
That's exactly right. It's exactly right. And in all fairness, they should. As patient safety is always the first priority for us, and the CIs are definitely the backbone of our academic program.
Okay. All right.
And I think we can go into the CI should consider the intent of the short-term objectives.
The rationale.
That's exactly right.
Yeah.
Exactly right.
Why it's important that they do what they're doing.
That's exactly right.
Well, let's see here. We got another slide to get to, and basically how we're gonna how the CI communicates these. How does the CI communicate to the PTA student regarding performance toward the learning objectives? So in other words, what they're going to be doing and how they're. I guess I need some clarification on this.
Yeah. My goal is for the CI to understand how to communicate to a student. That's the most important thing, is how to communicate to a student, how they're progressing toward the learning objectives for the course. The most important is that we want a positive learning environment. We want the student, there's always positives and negative in any situation, and we need to remember that we just can't point out what they're doing wrong, but we also need to point out what they're doing right.
Okay.
As an instructor, the next point I believe says that we're providing constructive dialogue. Really, we need to be constructive, and we also need to be assertive in telling the student what we need from the student in order to be able to achieve the objectives of the course. The third one I can't emphasize enough is we need to maintain open discussions, because as we saw, learning objectives are broad, and sometimes there can be some misunderstanding from the student of what actually the CI is intending. And sometimes we need to be told things not once or twice, or maybe the student needs it in writing versus then hearing it verbally based off of what type of the learner that they are.
Okay.
And the other one is the timing of feedback. It's very important. Students are very vulnerable. They're novice in their skills, and so we need to make sure that we provide feedback in the appropriate environment. Obviously, if we feel that there's patient safety of an issue, we need to stop the activity there on site. But we don't need to go up into huge discussion with the student, maybe in front of a patient or in front of other therapists in an open area, of why we needed to stop this particular activity. And so a CI may want to consider when they provide feedback for the student, if they're providing it during patient treatment, if they're providing it at the end of the day, somehow to make sure that the student understands that when the CI is talking to them, that they're focusing on them as an educator, and that it's not punitive.
Honestly, Tammy, this is good advice for any instructor, not just the CI. I mean, even if you're teaching English like I do, or you're teaching math, or any sort of discipline, all of those points are extremely important when you're talking to a student, assessing and giving them some feedback. When you do it, how you do it. I couldn't have put this better myself. That's great.
Let me give you, Sean, just a quick clinical situation where this may just be an example for clinical instructors. An example that we may be having a student set up a modality such as eSTEM, and this student needs to choose the correct treatment settings in order for the treatment go. However, the student didn't assess the patient's symptoms of pain prior to applying E-stim. And let's say our whole goal was to decrease pain, we're not going to know if E-stim is not effective unless we assess the patient's pain.
Mm-hmm.
The CI may ask the student to step out of the treatment area and will inform the student maybe what they didn't do, or ask the student if they should have done anything else. And then the CI may ask the student to rephrase why E-stim is being done. The student will answer for pain control, and the CI may ask is, how did we know if E-stim was going to be helpful if we're not assessing their pain? And then it's kind of like a little light bulb for the student that goes off in their head going, okay, now I'm kind of putting these pieces together.
Right.
And that's really what it's all about, is making sure that the student is learning how to be an entry-level clinician by the time that we're done with a clinical setting.
Yeah, that's a good example. I wish, you know what, I wish we had that on video so we could show, that'd be really great, but maybe sometime in the future we'll do something like that.
Yeah. Exactly. We'll see what has to come, right, Sean?
Yeah.
The reference that we used for this presentation today, we did use the American Physical Therapy Association, and more specifically, we used the Clinical Instructors Educational Credentialing Manual. They highlight several of these. Information that we are providing to you guys today. I hope it's been helpful.
I hope so too, but I know what, one of the things I think we do need to point out is the student weekly summary. I think that's something we wanted to get to, and we could do that now to sort of sum it all up.
Yep, thanks for bringing that to my attention. I think if it was back there on when we were talking about that the student needs to be an active participant in their education. I think it's once the student arrives. The clinical instructor we require our students to fill out weekly goal sheets.
Yep.
From here, the clinical instructor and the student should be both looking back at the objectives to say, okay, am I meeting the objectives of the course? And let's say that the student has not had an opportunity to set up traction, and that is an objective in the first two courses that the student hopefully has that opportunity to set up traction. The student and the CI may go, you know what, we just don't have a student, we don't have a patient that's appropriate treatment intervention for at this point in time. So the student and the CI may come up with a short-term goal as far as stating the student's going to review all the clinical indications and the contraindications of traction and report that back to the clinical instructor. If we go down just I think goals to be achieved this week. They may write that as a goal. They may write a goal that the student will be able to set up the clinical instructor on traction based off the clinical instructor's symptoms that they're presenting with and based off the information that the instructor maybe tells them that the PT found on the evaluation. The nice thing about the weekly goal sheet is it, again, is a summative communication from the end of the week. And it is making sure that the clinical instructor and the student are on the same page of what the objectives for the course are and where they anticipate of what they can do the following week. Because these are the weekly goal sheet is really baby steps toward the overall objectives.
Okay. Yeah, this is nice. It's actually something that I think most instructors would be a good idea for most instructors to use this, even if they're not in a clinical situation. I mean, I could think about using this in my own English class. Maybe not 3 things or activities that went well, but maybe 3, or not, maybe not 3. In my case, might be just one thing that I did well on my last essay. This is really, really cool as far as the ability to provide some informal assessment. I like it a lot. Okay. Well, great.
Yeah.
Well, I appreciate you doing this for your clinical instructors, and like I said, this will be available online, and they'll be able to view this at any time.
Yes, and any questions that you have about the material that was presented, or if you need help in setting clinical objectives up for your facility based off our objectives from our academic institution, I'd be more than happy to help you. Just please feel free to give me a contact. I can always be reached at 843-477-2067, and again, it's Tammy Marson as the academical clinical coordinator. Sean and I have also done another webinar that you may find benefit if you've not watched it, and that's specifically how to score the assessment tool for our first 2 clinical affiliations at Georgetown Technical College.
All right. Thanks so much, Tammy.
Thanks, Sean.
All right, take
talk
care.
to you later.